All right, so for our Snapp video, we'll start by summarizing the case. Our patient is a 3-year-old who's turning 4 in December. She's been diagnosed with autism spectrum disorder, and she's born with Chiari malformation, which means that part of her cerebellum was pushed through the foramen magnum into her skull, and it is compressing her spinal cord. When she was 2, she had decompression surgery in order to lessen the pressure on her spinal cord. She currently is participating in physical therapy twice a week at Red Door. And so for the N, we have a couple problems here that we narrowed down. The first one is mild hypotonia, and that's pretty common with kids with autism spectrum disorder. And it affects her muscles throughout her body, but it is primarily her core that we're interested in. It's pretty noticeable there. She also has some gait impairments and compensations. Her hypotonia causes her to walk and run with a wide base of support, and she keeps her hips and trunk in an extended position. She walks flat-footed, and her knees are always in a little bit of flexion, and we think that that posture is going to lead to tight back extensors and stretched out, weaker abdominal muscles. And we have already seen that a little bit when we were assessing her tone. We could feel that in her abs. So another problem that we noticed was stair climbing and descending ability. In the hallway of our building, we have those stairs and the ramps on the other side. So we would try to get her to go up and down the stairs, but she would run around us and go up or down the ramp instead. When we did hold her hand and have her go up the stairs with us, she would jump up each stair or jump down rather than walk up and down kind of like in a normal fashion. We were thinking that some of this might be due to distractions because there was a lot of other people around. And when we took her into the first year room and shut the door, she would walk up and down the stairs normally. It just kind of took a little bit of encouragement to get her to do that.
All right, so our main problem with our patient is the compensation for her hypotonia in gait and other everyday activities. So she leans her trunk and her hips back into that extension and maintains balance by relying on her Y ligaments to keep her upright. So this is causing her abdominal muscles to become stretched out and weak. If this lower cross syndrome continues throughout her development, she will have severe deficits in that core strength as well as back extensor, hip extensor mobility, and range of motion. So these deficits would create problems for her in the future when she tries to complete activities of everyday living. So that's what we mainly want to focus on with our patient.
So when we talked to Professor Hogan about some of the questions that we had regarding our patient, he said that she does have some motor control difficulties she has the strength to go up on her toes, but she just doesn't enjoy doing that, or she doesn't do it naturally. Like when she jumps with flat feet. So that's a motor control issue. And then also we're unsure at this time of how to get a 3, almost 4-year-old to walk without hanging on her Y ligaments or walk without being back like this. How do we get her to do that naturally? So for intervention, though, for next week, our plan is to do some obstacle course work with her, mainly working on her core and the weak strength that she has there. So that could include walking on her tiptoes to help with that, her motor control planning. The scooter crawling for her core, and maybe getting some reaching stuff, reaching with toys in front of her, because she also doesn't really like being out here. And I think it's more of a, again, maybe motor control issue, not so much strength. And then also we want to, since in PT that she has right now at Red Door, they're working on jumping with her. It seems like her focus is everything is jumping, so we're not going to do as much jumping with her, and try and limit some distractions that she had earlier this week. So we'll do the obstacle course and work on stairs with her maybe in the first year room so that it's more isolated. And then also we might try doing some of the Go Noodle videos with her for motor control as well.
That's it.
That's good.